Good afternoon, I'm Karen Hershey, and thanks for joining us for our live webcast with Dr. Arun Gulani, a world-renowned eye surgeon and founder of the Gulani Vision Institute here in Jacksonville. Today we're going to be talking about advances in LASIK and cataract eye surgery, and we're also going to be announcing the winner of our nationwide Gift of Sight contest. So stay tuned, that's going to be at the end of this webcast. But first, Dr. Gulani, you just got back from abroad. You were one of 2 eye surgeons asked to teach at an international conference in Cairo. Explain a little bit about what you were doing there and what kind of procedures you were involved with.
Well, it's very exciting, Karen. We were sharing all the latest advances that we do here already in Jacksonville. It was a privilege for me. My other colleague who was invited was a professor from Harvard, and both of us shared our latest techniques in advanced LASIK, advanced corneal surgery, artificial cornea, and cataract concepts. And it's funny, it's easy to say that we were teaching, but I think that's too cocky. I think we learn a lot when we go out too. Is that the doctors doing tremendous work all over the world. So doctors of tremendous repute and experience were there, and they're all flown into one central, what we call destination meeting grounds for instructors. So it's very, very exciting.
But you were also doing surgeries in front of hundreds of doctors, which has got to be a little bit scary.
It is, but again, you look at it as a responsibility and a desire to teach. It happens.
Well, that's great. Well, now going back to advances in LASIK. Now, LASIK is a vision-corrective type of surgery that corrects nearsightedness, farsightedness, astigmatisms. But you stress that these kind of procedures are not a cookie-cutter type procedure. You really customize each of these surgeries to the individual needs of your patients, correct?
Absolutely, Karen. Throughout our webcast, as we've been so successful in the amount of people listening and seeing these online, the one point that I repeatedly say, whether it's on stage nationally, internationally, or in this webcast, is to our patients is laser vision surgery is nothing more than changing the shape of the cornea of your eye, which is the front clear window of your eye, if you look at this model. So the shape of this cornea decides your vision. So if you're very nearsighted, this is very curved. If you're farsighted, this is flat. And if you have astigmatism, this is shaped like a football. So if you shape this up with the laser, you can really customize vision to each patient, and then be stressed for vision beyond 2020, because that, I believe, should be the goal of every LASIK surgeon today. So LASIK is not a cookie-cutter surgery where a patient can call up and show up and, be part of a mill kind of, and that's it, they're left with vision that they may not be so happy about. If you really customize the laser vision technique to the patient, you can even work on patients with thin cornea, high astigmatism, and even combine this with other cases to bring them to their best individual vision that you tailored for.
And how has the technology for LASIK changed over the years? Because, it is dramatic. Now we've talked about, it's lasers. You don't even cut into the cornea anymore.
Correct. So there are no cuts anymore, which takes care of over 90% of complications that were inherent with basic LASIK surgery. Technology has improved in 2 different levels. One is diagnostic. For example, the Penacam technology that we brought into Northeast Florida, and I just upgraded that while I was teaching in Germany, that helps me look at the patient's eye like a camera. When you look at the patient's eye like a camera, you have a spectrum of surgeries that you can provide. So you're not limited to only one surgery if you do only LASIK or only cataract. You really open up and say, okay, this is what's best for you. This is how I'm going to design it for you. And you come out with the best concept, with safety being the first protocol. The second level of technology is how LASIK itself has moved into a no-cut surgery. So further higher levels are you can do it in 3-dimensional observations, so the efficacy and the safety has gone up tremendously, so that more and more patients are becoming candidates who are told they're not candidates, and also the predictability of vision beyond 2020 has gone up tremendously.
And you kind of talked about this Pentacam, I'm going to say this right, Pentacam tomography technology. You were the first eye surgeon in Northeast Florida to bring this kind of technology. Can you explain a little bit more in depth about what this is and how it is helping patients?
Absolutely. Again, like I said to you, safety is a very big paradigm for me, where every time you innovate and take things to a next level, you have to make sure you're doing something safe for the patient, keeping their best interest long-term in mind. The Penacam technology is a Scheimpflug camera system, basically. It gives me a 3-dimensional view of the entire optical system of the eye. So if you think of the eye that way, you start designing vision for them based on what element of your eye can I change, whether it's laser, LASIK, ICL, putting in a contact lens inside the eye, combining the surgeries, no limits. Once you plan that way, it gives me an inherent potential to decide what's best for each patient.
Okay, and we actually have one of your patients, Diana Beebe, if you want to come up here and join us. As usual, we bring in a patient so that we can talk to them. And with this Pentacam tomography, explain a little bit about how it helped Diana and what it meant in terms of customizing her surgery.
So in Diana's case, Diana, it's a pleasure to have you here. And what I love about my patients is I'm so proud of them. I can't say enough. I love the fact that they've done their research. And I still love this, and all of you know this, their testimony to this is in the rooms when I meet with them, I want them to grill me. Because really, I believe that's what gives them the knowledge of, okay, this is something that's best for me as a patient. And also, they get the confidence that the doctor is striving to do the best he can. In Diana's case, her cornea is being thin with high astigmatism and also having large pupil. When you plan with technology, you now want a procedure that is not just basic LASIK. Now, she would have been happy with the basic LASIK, but she would not have realized what was left behind on the table. So when you aim for that kind of surgery, today, Diana, you're over a year, you're over nearly 3 years?
3 years now.
Nearly 3 years.
Yeah.
And you still want to have that vision consistent as what it is, so that's how it helped me to design her vision.
When you first went in, were you nervous? Were you scared?
Yes. I had chronic corneal abrasions. Say that 3 times. So a great deal of pain. We talked about the different procedures, what we could do. I asked him where I could read more about this. I'm a perpetual student at heart. And I did my research for like 6 months, would schedule different appointments with him, and you know, why aren't we doing this? And he explained the difference in the shapes of my eyes and what I was dealing with at the time. I've been legally blind since I was 10 years old. I've worn glasses since I was 10. So in my 40s, then, when I had the surgery, to be able to see, I can see you. I can read across the room. I cried. He allowed my father to be there when I had my surgery, and to look up and to see all the way across the room and be able to see my father's face. Without glasses, it was just amazing. And I can read to my grandson, so, you know, it's near and far and everything is just perfect. It's beautiful.
So it's really changed your life.
Absolutely, absolutely. I don't wear glasses other than sunglasses, and I can buy the pretty ones now.
You don't have to get the big, thick...
I don't have to get the big, thick prescription ones with the bifocals and everything else. And no, I can see.
And do you feel like that the Pentacam tomography, I mean, helped, like you said, customize your surgery?
I have 15/15 vision right now, and I'm 52 years old.
And it's been 3 years.
And
no
it's been
problem.
3 years, no problem.
Well, it's amazing. Thank you so much for joining us. I
You're welcome.
appreciate it. It's very exciting. And again, another story of a person who's been touched by this. And like you said, it must just be nice to be able to wake up in the morning and to be able to
Look
see
across the room and not trip over the cat. Yes.
Thank you very much, Diana.
Thank
We
you.
appreciate it.
No problem.
And one thing that Diana kind of mentioned, she has better than 20/20 vision, which is something that I think a lot of people strive for but don't realize that they can do it. So obviously it is possible.
Yes. I'm a strong proponent for this whenever I teach nationally, internationally, because I'm a strong believer, because majority of our patients do see beyond 20/20. I believe the secret is the surgeon has to aspire for that level. Like I say to them, it doesn't matter if the patients don't get to that level because it's based on their individual capacity. Remember, it's the brain that sees, not your eyes. But I believe every surgeon has to strive for it. So when the majority of your patients are seeing beyond 20/20, and you do know that that reality exists, it becomes difficult for me to fathom that 20/20 is perfection. So I'm a total opponent of that. I say always aim for beyond 20/20, and then you have also long-term follow-up, which I do a lot as a teacher of LASIK and advanced cataract surgery. I document our results when I teach because I believe that's a responsibility. So as Diana's case, she's 3 years out now and still better than 20/20, so that tells me there's consistency also.
And does it usually last long? I mean, how long can you have better than 20/20 vision?
Again, there are different levels. One is the surgery itself is supposed to be permanent, so it's done with the desire of permanence. That's why I keep stressing. And as every patient you'll keep hearing is I insist they do their research. I see them 2-3 times, measure, remeasure, measure 10 times, cut once. And two is the age-related changes that happen can also change your vision.
Yeah, and that always is going to be, that's not something that you can avoid. It just
Exactly.
automatically happens.
Exactly.
Lola Tam is another one of your patients, if she could join us right now. She's another one of your patients that has better than 20/20 vision. What percentage of your patients are seeing better than 20/20?
Again, depends because I do the whole spectrum of
Okay.
vision corrective surgeries, but majority of them cross the 20/20 line, and I believe that many doctors come to train at our institute. The thing that I honestly share with them is I believe the secret is the doctor has to measure with highest accuracy and then of course have technology that can deliver that outcome.
Lola, why did you come see Dr. Gulani? Tell me a little bit about your story.
Well, I did some research with looking at different doctors, and I also did the Googling thing, you know, as all young folks do nowadays. And I did interview several doctors, and I didn't know who to go to at first. But then, you know, going through Googling, it told you some of the stuff that you should talk to your doctor about. And I felt like Dr. Gulani had the confidence, he had the ability, he definitely explained everything outright, and he was really open and really honest, and he's a perfectionist. So I wanted better than 20/20, and some of the doctors were like, you might get 20/20, you know, but I want more. So being a perfectionist kind of, you know, it was similar to me, that I wanted the best.
Where does your vision stand right now?
2015 for sure, some 2010. I even texted my friends. Yeah, I texted my friends, can you read that?
And how long has it been for you in terms of having the surgery and having...
I did it in late September, so it's fairly recently. The recovery was a little frustrating at first, but then after the recovery time, it's been amazing.
Have you had any problems?
None.
What has been the biggest change for you?
I get to see all the details, all the patterns. All my artist friends kind of show me all the details in the artist, and now I can see it. Of course, convenience is there, but it's just the ability to see the things that you just didn't see before. Even this white hair in my head.
I don't know if I want to be able to see that in the mirror. All right, then. Well, thank you so much for joining us. I appreciate it, and thank you for sharing your story with us. So thank you very much for being here. And Dr. Gulani, you say that not only are there a lot of advances in LASIK, but also cataract surgeries. And according to the National Eye Institute, cataracts are very common, especially in older people, and also it's the leading cause of blindness in the world. So what exactly is a cataract, and how does it affect people?
So cataract, basically, if your eye is a camera, Karen, all the laser vision surgeries we just discussed, including LASIK, happen to shape the cornea, the front viewfinder of your eye. Then cataract is when your lens in the eye over here becomes cloudy. So the clarity of the lens as we age loses its clarity and becomes cloudy. That's what's called a cataract. So when this cataract's in your way, it's doing many things. It's making your vision obscure because it's an opacity you're looking through. Also, it changes your visual quality. Now, what I'd like to talk about is not only is that cataract a problem because it's in your way, like an obstruction. Because it was a lens to begin with, it has power. So you can take that opportunity of a cataract and help somebody see without glasses.
That's just amazing.
Because you can manipulate that power using technology and come out with a zero power, so they don't need glasses. And imagine that for patients who are having cataract now in their early 60s, they're going to live the rest of their life with total freedom. Now, take that to the next level, what we've been talking at the international meeting last week. To replace that cataract, we have to put in an artificial lens, because remember the cataract was a lens to begin with. So that artificial lens nowadays can also be progressive. It can have multifocal zones on it. And when you have that, you can see distance and close, and read without glasses, and see distance and drive without glasses. Take that to another level. Even patients who had previous refractive surgery like LASIK, previous keratotomy, whatever they did to remove their glasses when they were in their 20s and 30s, even those patients can be corrected back to excellence for distance and near without glasses. So that's the level of cataract surgery that I expect today and talk about.
Okay. Now, the one thing, you have invented a lot of instruments that are used in cataract surgeries. You're also teaching surgeons all over the world how to use these instruments and how to better their own technology. And this innovative technology that you're teaching is the multifocal lenses like the Restore, the Resume, and the Crystalline. Can you explain to people what those inventions are, and again, how are they reshaping the whole way we look at cataract surgeries?
Sure. So, like in any eye surgery, our continuous aim is to make it safer, more visually predictable, and have a more long-term effect on the patient's lifestyle. So instruments that I've designed make the incision or the surgery itself much more compact, much more elegant, faster to heal, and less influenced by the surgeon's technique, so that makes it more equal across the world. 2, technology that we have where we can catch a cataract earlier. So patients may come in for a LASIK in their late 60s, but they may have early cataract. So you were doing wrong by going for LASIK if that's all you will do. You rather do their early cataract surgery and free them up completely. Now, like we discussed, when you remove the cataract, you're going to put in an artificial lens. That lens could be a normal lens, what we call monofocal. It's just good for distance. It could be multifocal, like this. So it has the progressive glasses kind of built into it. So you can see distance and near. Depending on that technology, you have different kinds of lenses. One is called a crystal lens, where the lens kind of moves in the eye, like a tele and wide of a camera. So you can see distance and near. The other kind of lenses have these progressive areas built into it. So just cataract surgery itself today can be designed, tailored to each individual. So I don't like the word routine used with cataract surgery. No cataract surgery is routine, no. I mean, I know patients like, okay, I have cataract, let me go in next week and I'm done. No. I want the doctor to stop and think. You have cataract, but you also have farsightedness, you also have astigmatism, you also cannot read. Let me fix everything with one surgery.
I like that idea. Again, not a cookie-cutter approach, the big thing. Dr. Don Morford is also here, another one of your patients. Tell me a little bit about him as he comes up and sits here with us. What did he have done?
Sure. Hi, Tom. Thanks for joining us today. Don is, he also, like all our patients, and that, like I keep telling you, I have no words to describe the pride I feel with my patients, he's done his extensive research before he came to me. Donald had not only had cataracts in his eyes, he had previous radial keratotomy surgery. Before LASIK, in the 1980s, there was a very famous technique called radial keratotomy, or RK, to get rid of glasses. All those patients today are in their cataract age group, and they're looking for help because they can't see again. And they need not only to see, but they also want to see distance and near what they were used to before. So it's a major challenge which I have called an epidemic in the country today. So Donald represents those patients where not only do we have to do cataract surgery, but we have to raise the bar on ourselves as surgeons to bring them up to a freedom of distance and near despite their previous RK surgery.
Okay. How do you feel now?
Oh, it's wonderful. Also, I was having trouble. I couldn't drive at night, which was becoming an increasing inconvenience. And that was partially from the effects of the radial keratotomy plus the cataract developing, and it was very limiting in my lifestyle. Also, I read a lot, and it's now convenient that I can read and see at a distance and not have to be changing glasses all the time.
Did you talk to a lot of eye surgeons? Did they tell you the things that Dr. Gulani was saying to you, or did he stand out compared to some of those other eye surgeons?
I really fell back upon the recommendation of my optometrist that I'd been going to for a long time, and he just had nothing but praise for Dr. Gulani, and my wife researched online, which she's a research librarian, and the research that she did confirmed that it was ideal to go to somebody like him that was trying these new techniques. And
where is your vision? How does it stand right now?
I think mine's more like 20/30 unusual, but I am able to read and do everything I need to do. And
so it changed your life. I mean,
yes,
you
definitely.
Were you nervous that you weren't going to be able to find someone to do the things that you needed done?
I was nervous because I'd been through the radial keratotomy before, and really didn't have an easy route with that. I had surgery multiple times on both eyes, and I had some distortion in my vision, and it wasn't exactly a pleasant experience.
Yeah.
And this was a lot easier.
And I think that is what is so important to mention, that that we've talked about so many times in these webcasts, is that even though you have a type of surgery, like you've had something before, multiple times, your eye vision can change. You might need help again, and there is help out there. It's not like once you have a surgery, that's it. You can't fine-tune your vision, because I think that is so important that a lot of people don't realize. Well, thank you so much for joining us. I appreciate it. Thank you. And fine-tuning that vision, is it difficult? I mean, is it something that, you spend a lot of time, obviously, with each of your patients, but it is possible to do it.
It is possible, Karen, but think about it. I like to describe this when I'm teaching surgeons like Lego pieces, all right? Now you've been given broken Lego pieces, slightly imperfect, and you still have to build your perfect plan. So yes, it is more difficult than what we call a virgin eye case, where you're going to a cataract or doing a LASIK, where you're so highly predictable. In these cases, you have to build back their story, look at the mathematics, the anatomy, the architecture of what previous surgery did to their eye, and still project where you want to land with these patients based on their lifestyle. I do a lot of doctors and surgeons are my patients, so for them I have to take into consideration, okay, what's his profession? What would he like to see? Of course, they'd be happy anyways if someone could even do their surgery, but that's where I like to defer. As surgeons, it's our responsibility to give them the best they can.
And you also do combination surgeries. So you can do LASIK and cataract surgery at the same time.
Not same time, but on the same patient.
On the
yeah.
same patient.
Yeah.
And so that is something that you do see and that people do run into, correct?
Yes, and again, let's say if we do surgery on somebody who had, let's say cataract surgery on somebody, and I come in a month or 6 weeks later and you can correct the shape of their viewfinder, correct the astigmatism using laser.
Okay. What do you see in the future for these types of surgeries?
I see in the future that practically every patient who has the potential to see and has an eye that has no diseases has the capacity to be a candidate for vision corrective surgery and lead a life without glasses.
Okay. Now, of course, this is the moment everyone has been waiting for. We are actually going to be announcing the winner of our nationwide Gift of Sight contest, and I'm going to let Dr. Gulani do it a little bit. Tell me a little bit about this contest and what it all entailed.
Well, in our desire to give back to the community, and we have so many patients come from all over the world that have overwhelmed us with their loyalty, with their dedication, and their belief in what I do. We decided to give away a free LASIK surgery with me, and this was a nationwide contest where potential candidates or their loved ones for them would submit a 1-minute video explaining in that video why they think that particular patient deserves a free LASIK surgery with me. And I think the panel of judges went through a very dedicated process, and I picked the winning video, which was really touching. I'm sure they're going to show it here today, so it's been a real pleasure.
And so the moment we've all been waiting for, who is that winner? Because again, this is a nationwide search, but excitingly enough, the person selected is from Jacksonville.
Yes, that is correct. That coincidence too, and the patient's name is Stephen Gilbert.
Ooh, congratulations, Stephen Gilbert. Now, here's a little bit about Stephen. He is totally dependent on glasses and cannot see without them. And I believe it's his mother that sent in this video. She takes care of him. He has autism, I believe, and they had consulted with numerous LASIK eye surgeons about her son's case, and they said that, you know, it was just too complex, that no one was able to help them. So she had obviously put in this Gift of Sight thing, and we actually have her contest, the winning video that we're going to show you that aired on YouTube right now. So we'll just wait for a second for that to pop up.
Hello, my name is Beata Gilbert, and this is my son Steve. He suffers from a severe case of autism and depression. He was born 8 weeks premature and had problems since birth. At age 2, he had an operation to straighten out his left eye and needs to wear glasses. But because of his autism, he cannot deal with wearing glasses. Due to his bad eyesight, he is dependent on his brother and me to help him get around, since he cannot see more than 2 to 3 feet in front of him. It is very hard for a mother to see a child suffer and not be able to help. This Gift of Sight would make a big difference in his life and help me financially, because I am a widow on a fixed income. Thank you for your consideration.
And I believe we have Mrs. Gilbert on the phone. Mrs. Gilbert, are you there?
Yes.
Tell us, I mean, now your son is the winner. What do you think? I mean, what's kind of going through your mind right now?
Well, I'm about to cry.
Why was it so important for you to do this for your son?
Well, it's very hard. He cannot go anywhere without his brother or me. And he told me, I asked him what he would think about being able to see, and he said, "Oh, Mom, as long as I know where everything is in the house, I'm fine." But when he wants something from me, he has to come to me, and I have to move or talk to him. I can't just look at him because he can't see it. And he cannot walk. He gets anxiety attacks when he has to go up or downstairs because it's just a big hole for him. He has to feel with his feet where he has to go.
Well, this is going to be obviously very huge for not only you and Stephen, but your entire family.
Yes, it will, because it will be the first time in his life that he sees the world.
That is going to be amazing. That is going to be absolutely wonderful. And obviously, Dr. Gulani, this is a great person that's going to be getting this gift of sight. It is a true miracle for the Christmas time, obviously. Mrs. Gilbert, have you talked to your son about it? Does he understand what's going to be happening?
I don't know. So it's because he doesn't know what it means to be able to see.
What is it going to mean for you to have him see? I mean, to actually for that time, you know, when Dr. Gulani, when they get this procedure done and he opens his eyes, I mean, what are you anticipating?
I don't know what to expect. It's because he doesn't react like I would, or, you know, but I don't know. It's just a relief for me because I'm alone. I don't have any family. If I'm gone, they're on their own. And so I need to prepare them the best way I can to be on their own. So it's very important, and I know that I want this for years now, but it's just the money all the time.
Yeah. Well, thank you very much, Mrs. Gilbert, and congratulations to you and your son, and obviously we'll get you in touch with Dr. Gulani, and we'll look forward to hearing how that surgery goes. So thank you very much for joining us.
Okay, thank you for choosing us.
Congratulations.
Thank you so much.
What a great story. And unfortunately, that's all the time we have for today. So thank you, everyone, for joining us with this webcast, all of Dr. Gulani's patients, and also to you for watching us. And we're going to be back again on January 13th. We're going to be talking about corrective LASIK surgery, which is obviously a big deal for a lot of people. And if you have any questions about what we've talked about today, or if you want to get in touch with Dr. Gulani, the number is 1-888-LASIK. 16, or that's 904-296-7393. You can email questions to GulaniVision.com or ask Dr. Gulani at WJXT. And again, we're going to be back here next month, January 13th at 12:35. And again, the big thing we're going to be talking about is corrective LASIK surgery, which does affect a lot of people. Have a great day.